Let us wait, sir. There was due to some technical problem. Everybody, the program was ended. So let us begin now. People are joining now. Please wait. Let us wait for 1 minute so that everybody can enter the thought. Okay. Good evening, good afternoon, and good morning. This is the 1275th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. Madhusudana Panickere from Kerala. Let me introduce Sir. Sir was the former Chief Medical Officer at Government Homeopathic Hospital, Alappuzha, and he is presently practicing at SN Homeo Clinic, Kalavur, Alappuzha. And he is one of the most wanted faculties from Kerala who has delivered lot of presentation in this forum. All these presentations were superb. And as you all know, he is a person who was instrumental in bringing up a cancer hospital in cancer department at government hospital at Alappuzha. And there are a lot of patients there now continuing treatment. And he's a person who is having a lot of advanced pathological cases with him. And he has presented some of the brilliant cases in this forum earlier. So let us, today, sir will be talking about the medicines of a group of medicine which are very, very important as far as the medical study. Each and every group study is very, very important. And as you all know that today's subject is also a special one, group studies. Her has presented some group studies earlier also. And the presentation of this day is acid group of medicine. So let us invite Dr. Madhusudana Panickere sir to this session. Welcome, sir.
Pranam to Samuel Henman. Pranam to all of you. So, today I present the beauty of vast group of homeopathic medicines, common characters, special characters, therapeutic values, and rare indications apart from other acids. The group of so we can enter the first of all the thermal reactions of acid group, mainly the inorganic acids are syphilitic, organic acids like psychosyphilitic. All acids except muriatic acid, picric acid and fluoric acid are get relief by cold. So the psychotism in syphilitic miasm is prominent in these three acids. So the discussion with acid group, I start with most acids are from mineral kingdoms, few are from vegetable kingdoms. Normal value in human blood is 1.5 to 2 mCH per hour.
Sir, you're sharing the screen or not?
No, sure, sir.
Okay.
No screen. Only the discussions. Because there is no time to prepare the slides to expose. Okay, fine. Forwards. Hypo reduction of the acid result in hypochlorhydria and hyperproduction result in peptic ulcer and gastric ulcer. These are the consequences of acid status in our body. two groups of acids, one inorganic acids and organic acids. Inorganic acids are boric acid, chromic acid, fluoric acid, hydrocyanic acid, muriatic acid, nitric acid, sulfuric acid, and phosphoric acid. They are very strong in action and quick in strong acids which give quick actions and the severe degenerative process if it is using in excess form. The acid group, the constitutions of acid group as thin, weak, broken down constitution, fair, hair loss, baldness, pale, anemic, debility, prostrated, stoop-shouldered, and premature old age. So the appearance, the constitution of acids are again thin, weak, broken down, fair, hair loss, baldness, pale, anemic, prostration with debility, and stoop-shouldered person with a premature old age look. Organic acids are slow in action. Characteristic features of the acids. It is a very good action in surgical shock, suppression of grease and ailments from grease disease originating from loss of sleep, prolonged loss of sleep, ailments from mortification, injury, bad effect of bite and stinging of insects and animals, after effect of anesthesia, abuse of narcotics, occupational hazards, loss of vital fluid, physical and mental weakness. These are the characteristic symptoms of the common organic acids. Now, what are the inorganic acids? They are acetic acid, acid salicylic, benzoic acid, carbolic acid, anamic acid, citric acid, formic acid, lactic acid, oxalic acid, picric acid, salicylic acid, succinic acid, sulfurous acid, uric acid, and tannic acid. These are the inorganic acids which are used in homeopathy. Its action. It decreases the secretion of body and increase the alkalinity of in the body. For example, citric acid taken into the stomach, it will diminish the secretion of the gastric juice, but on other hand, it will increase the production of saliva in gastric intestinal tract to balance the acid-peptic relationship and balance. So it will prevent by balancing with the endocrine secretions. They prevent ulcerations of the mucous membrane in the mucous outlets. It produces exhaustion with acid imbalance. So the all acids producing the speciality of the acid ulcerations are painless ulcerations, especially in gastric diabetic gangrenes. Varicose ulcer with the gangrene which get relief by cold application, severe burning, but no pain, only burning sensations, toxemia, septicemia, ulceration and malignancy is the consequence of acidic pathology. Anemia, leukemia, hemolytic jaundice, and acidosis. Slow progressive metabolic diseases like diabetes, uremic coma, uremic diseases, debilitating malignancy with burning, bleeding, cramps, fissure, and fistulas, and all type of fevers, malignant fever including, with its general debility, anemic, weakened, exhausted character we find in fever. With the in acidic constitution, we can effectively use acid picric acid force like medicines in acid group. Mind, exhaustion, hurriedness, irritability, extravert, but they are perfectionists. Perceiving power increased. Wearing of life and depression. Malicious, jealous, suspicious, and loquacities are the other characters of mind. Weak memory with the confusion. They are before developing the pathology, they are highly industrious. Burning, weakness, bleeding ulcers with painless nature. Ailment from prolonged vital fluids. Mental and physical weakness. Discharges are watery, acrid, sour, blood-stained, excoriating, offensive, soapy, thick, stringy, alkaline in nature. The character of the ulceration is painless and the discharge is watery, acrid, sour, blood-stained, excoriating, offensive, soapy, thick, stringy, alkaline in nature. But we can use this pathological indication for even cancer, cancer mouth, varicose ulcers, diabetic gangrenes, diabetic ulcers, gastric pathology, all of them are with these type of discharges. Desire for alcoholic and acid food, citrus food, chalk, pencil, egg and meat, with the character of syphilitic miasm. They always prefer to eat meat and aggravation after eating it. They always prefer fatty food, cheese and ice creams, especially the acetic acid, the entire hyperchlorhydria, acidity and burning sensation in the stomach with acute gastritis, chronic gastritis, pancreatitis or gastric ulcer. If they prefer ice to regulate the pain, the best medicine is acetic acid. Aggravation, night aggravation. So the syphilitic character predominates in acids group. Exertion, cold drinks, except acetic acid. Loss of sleep, mental tension, worse, grief, amelioration, rest, heat, sleep, and discharges. Clinical conditions, Bell's palsy, Reiter's palsy, diabetes, benign hypertrophied prostate, with the polyuria night, weakness after polyuria, exhausted, natural discharge aggravation, syphilitic character, sartoriasis, spinal degeneration, electrolyte pain, rheumatic heart diseases, rheumatism, chorea, hemorrhage, ulceration, gout, cancer bone, ascending paralysis, cancer with the cerebral softening. Due to, we can find in acid group the coordination of mind, orientation of the mind is disturbed, highly lost. In malignant diseases, we can thought of especially citric acid and acid force. Ascending paralysis with the painless ulcers. Anemia, especially pernicious anemia. Myocardial infarction. Hemorrhoids, UTI. Rectal cancer. We know that the acids, especially acid nitric and acid more, is very effective in rectal cancer. The indication is burning, bleeding, ulceration, get relieved by hot wash or warm wash, acid nitric. If it is aggravation by warmth and get relieved by cold wash, muriatic acid. The acid group are the complementaries or effective follow-up. Ammonia group are the further follow-up medicines. These are the general characters of the acid, sphere of action of the acid, aggravation, ameliorations, sphere of actions. All these are we discussed today. We can study one acid in detail. I select this phosphoric as the common medicine which used in our day-to-day practice. The total indifference. Lying on bed, facing to facing upwards and see the upper part of the house, always without any action or reaction or talking. The person was strong mentally, emotionally, or physically, but due to this certain repressed situations, they become as force mental nature gradually. Mild, dreamy, pale, sulky complexions. Blue margin around the eyes due to loss of vital fluid and low oxygen level. Characteristic weakness with indifference. The weakness mainly on physical level. The patient is weakened in physical and mental level, so they has indifference to routines and subordinates. Don't want company, aversion to answer, want to lie down in bed and needs to keep quiet. The indifference, weakness, exhaustion, we can see the nature of the person by explaining don't want company, aversion to answer, wants to lie down in bed, needs to keep quiet. Emotional weakness, indifferent to work, joy and excitement. Answer slowly only. We can question 5 to 10 times, then only is a yes or no, or want or reject. They are mostly the ailments from victims of lack of love. No love, no care. In children, we can see nightmareness, Listlessness means dislike to talk, dislike to answer, dislike to communicate, indifferent to those things that impress him at a later of life. Thick layer of depression, gradually increasing and make tail of depression, causing indifference, weakness, apathy, and lying on bed with none to answer or reaction or aversion to food, likewise lying like a log. Silence from chronic prolonged grief. Dullness, introversion, complete indifference in grief conditions, in diseased conditions. Most of them are caused by the ailments or change of family situations. In children, there is an support conditions. Children become weak, exhausted, silent, indifferent to mother. When they like feeding and in any circumstances with the mother, suddenly stoppage of breastfeeding can cause an acid force conditions. And is a very good medicine for that condition, the acid force. We give 30 in poppy seed pill, 3 pills twice daily for 1 week. Likewise, change of love, situations, atmospheric and nature of life. If a sudden change in their life, transfer of job, sell the house and go to different type of atmospheric field, we have to tendency to or otherwise compels to stay in house which don't like. These are conditions can create acid force medium, sensitive to noise. The prolonged use of telephone or ailments from prolonged addiction of telephone, mobile phones, the condition can arise in the early field of life. Or exposed to high-pitched noises, excessive reading. They are like comics with the broken friendship. As our Sarsaparla, the ailments from broken friendship. The acid force is a very good medicine. Silent grief will not quarrel. They become silent and silence. With the grief and broken friendship, the ranunculus bulbis is always quarreling. But acid force groups are not quarrel, but they go to a maniac stage of silence. A bent state of emotions, trigger, overwork, sorrow, whimsy. But top level of emotional depressions. In mental level and physical level, disturbance of sleep prolonged, causing night sweat, obesity with emotional depressions. The active people in the first stage then become the most lazy and obese due to the overrest and sleep in daytime and aversion to work and all excitement can cause large body with almost indifferent to life and family and the companionship. Ailments from oversex or over medication. Certain people are studying and studying and studying without any interesting job or satisfied job, they are lastly become diabetic or hypertensive with exhausted mind and no desire to work with their own preferable job. We can boost up with the acid force in hypotension. Ailment from sexual or mental torturing in the early period of life from the dependent person. We have got many cure in autism and ADHD and chronic headache. When we against taking the sexual and mental torturing from the dependent persons, second father, teacher, or tuition teacher, or any type of persons, the best medicine we thought of acid, especially acid force. Sleep in the chair during working hours or in daytime. They are always, they take a paper or textbook to read and sit in the chair, but immediately they go to sleep due to exhaustion and physical weakness. A guilty feeling after masturbation, like Sapsagria in the second or third stage, they are doing masturbation, doing sex with others, and love family in a sacred way with the guilt of illegal sex or masturbation. Like Staffy, the acid dose is also a guilty feeling after masturbation or illegal sex. The acid was also a very good medicine in syphilitic miasm, but the Staffy is in psychotic miasm. The person with unequal dilatation of the people. We got a case of intraoptic hemorrhage with the unequal dilatation of the people with a patient. I first of all gave crotalis cordus, but there is no effect. But due to then we take the case with the exhausted feeling with the constant, not sexual, but physical and mental torturing from his father-in-law. The history we explained, and we give asked post 200 twice daily for 3 days and wait. Within 2 months, the entire character of the lesion is vanished, including unequal dilatation of the people. The trembling of hands when urinating. It is a rare PQRS symptom. We can go with the brain disease or diabetes or any exhausted conditions, even in ascites. If the trembling of hand is prominent with weakness, polyuria, we can try with acid force. Involuntary urination during pregnancy. In fever, there is a rare peculiar symptoms of cold feet, face hot, night sweat, chill, and weakness and thirst. These are the 4 symptoms of acid force fever. Cold feet, night sweat, face hot, chill, weakness and thirst. Sleep due to physical and mental weakness. They always sleep in the chair in daytime, so they can only sit in night like Pulsatla. So Pulsatla is psychotic. The acid force is stability. Painless diarrhea, painless ulcers, painless necrotic conditions, painless gangrenes. When we study the pathological origin of diabetes, we can get sort of lot of concomitant symptoms. Thereby, we can select the apt medicine for diabetes. I explained in my previous seminars But in diabetes, in acid force, nervous origin, the diabetes from nervous origin, from any torturing, prolonged torturing from husband or from wife or subordinates or second father or teacher, from anybody which depended in the life, in different part of life, they can convert it into deep-seated diseases like mainly diabetes. So we can thought of acid force and uranium nitricum. These two medicines are for nervous origin diabetes. The extraordinary PQRS of the diabetes is diabetic in the acid force is jelly-like urine. When we examine for RE, phosphaturia can be found. These are the general natures of the acid. Mainly we studied and used. These are the main medicines, especially for acid force. In acid more, we have got great cure in rectal cancer with asthma. The predominating symptoms are when they are passing urine, the desire for stool is predominant. Like aloes, like not in aloes only the unnoticed stool during passing flatus, but the pathological invasion of the rectal cancer, the adenitis or inflammation or metastasis of the just below, just upper part of the rectum can cause irritation or metastasis to urinary bladder. Then that condition or the adjacent enlargement of the lymph gland met, there is a pathological developments in the process of urination and stool. We get the symptoms that when standing for urination, there is the unnoticed or strong desire for stool in acid force with itcherous acid more, with itcherous, bloody, unnoticed, offensive, or eruptive stool. So when we the other special symptoms is the discharge and irritation and burning is get relief by cold washing. If these pathological coordination of the symptoms with weakness, anxiety, mental depression from mental torturing or constant irritation business or any like constant irritation mental and physical level or the prolonged sitting job or prolonged intake of excessive acid food, the spicy food or alcoholism, we can think of this acid more. The main symptoms for rectal cancer in acid group is unnosed is a loss of sphincter power, loss of sensitiveness of the mucous outlet, paralysis or degeneration of the musculature of the sphinctered orifices of the body. The all symptoms get relief by cold application. We can get very good result in acid more 0.3 4 times daily. For continuous 2 or 3 months, gradually the pathology will subside. We get cure for rectal cancer. So the deep acting, slow acting, very strong medicine is acid more in rectal pathology or mucous outlet pathology or mucus structured organs. These are the main medicines in in picric acid. The mental paralysis, cerebral paralysis due to structural ischemic prolonged condition due to the mental stress, prolonged stress, emotional depressions, financial crisis for long period. So in these factors, the main central nervous system will affect in acid picnic. We are always, but it is gradually gradually acting medicine. So the result only we get in 3 months. So these type of cases, when we get picric acid, we advise the patient to, we are got a good medicine for your conditions, but you have to wait for minimum 6 months with us. Then only the result will be gradually appearance only after 90 or 100 days. If we are ready for it, it will cure. That way, we make a confidence in patient in ourselves and give acid medicines. Also in diabetes, the acid dose also is gradually acting medicine with good result. The first changes when we give in diabetes, you have to first of all test the urine for phosphate. Definitely, we can, without any symptom, we can come into conclusion with the medicine is acid group and acid dose. Then after 1 month, we have to check for it. If the phosphaturia is reducing, definitely the selection of medicine is best. You go with the gradually increasing potency even in grade type 1 diabetes. Then I have got a molecular effect in tannic acid. Tannic acid pathology, there is a thickening, narrowing of the intestinal epithelium and structure, musculature of the intestine due to polyp or any cancer conditions or any IBS or any other pathological condition which is related to the lifestyle. If the ultimately the cause, the pathology developing is the narrowing or constriction of the intestinal musculature, the best medicine is tannic acid. So I conclude for the time being about the acid study. We can put any question and doubts for it. Okay, Dr. Tanish.
Yes, sir. Yes, sir. Shall we go for discussion? Sir, shall we go for discussion?
Yeah, yes, sir.
Okay, sir. One mobile.
With my experience, there is another acid benzoic. Acid benzoic, the pathology is based on rheumatoid arthritis with the degeneration of joints. The outward symptoms is cracking in joints and swelling, painless excessive swelling in the bony joints or cartilaginous joint or synovial structured joints. In these places, if we developed a uric acid pathology based on uric acid pathology, and the main symptoms is crack on joints or movements. The acid benzoic acid is a very good medicine. The main symptoms is offensive urine. The general character of acid offensiveness, weakness, degeneration, destruction, swelling with the hard swelling, but there is no pain. In arthritis medicine, can think of the acid group of medicine in painless arthritis. The all other group of medicine has painful arthritis. But in acid benzoate, the main symptoms is weakness and swelling, synovial infiltration or dryness with the cracks joints. So we can put questions of any other acids
Yes, sir.
or any other controversies or any other explanation.
Yes, sir, definitely. You have just done justice to acid group because almost all symptoms were covered in your presentation. And we are looking forward for some of the cases that you are able to cure with those symptoms also.
Yes.
Yes,
Yes.
that if you have an experience, usually people used to blindly give acid for these diabetes, but you have correctly mentioned the symptom because patients who are coming after mortification or some, or they are suffering due to a lot of torturing by the officers or husband or from a political world or somewhere else. And they suffer after that of this particular torturing. Then in those conditions, acid force works well.
The
And
torturing from dependence.
yes,
It is the best flow of acid force.
yes. Then how will you compare the acid force with the urine and nitric in those conditions, sir? How will you
Sir,
give?
uranium, the pathology produced by uranium natrium is especially in the islets of pancreas and the cells. It is act to stimulate the basic fundamental deficiency which we have to we have seen in diabetes mellitus, especially in diabetes mellitus group 1. The diabetes group 1, the C-peptide is reduced.
Yes.
So there is a wonderful action in type 1 diabetes, uranium nitrogen 30. We give 30 poppyseed pill, 3 pills twice daily for 1 month. I got benefits so many patients, and we can stand without insulin with the tablets in diabetic grade 1. So there is a definite action, uranium nitrogen, in pancreas, especially its endocrine essence of the pancreas. So whenever we want the stimulation for pancreas, even in the chronic pancreatitis, we find in blood examination reduced, increased lipase amylase and reduced the calcium. So when this condition arise, we treated it with one bias medication. Most probably the constitution will have to get is phosphorus. It's vomiting, it's craving for cold. Especially phosphorus has got a definite action in pancreas. So we approach the disease in 3 ways. One by stimulating the entire causative factor with the constitutional medicine, and localized it stimulate the musculature part of the pancreas to produce the stimulation pancreatic gland by iris verse tincture. Then the enzyme of the gene of the pancreas is stimulated by uranium nitrate. Any pathology, even in cancer, in pancreatitis, chronic or any acute or related, any pathology we develop in tumorous growth of pancreas with or without malignancy, we can confidently, with result-oriented treatment, we are massively using uranium nitritium in potency 4. So very, very, very good medicine. So the acid post, the physical condition, the maintaining cause of acid post, with the weakness gradually in chronic diabetes, the entire system will exhausted due to the malformation and ailments from the diabetes. So in multi ways, from different side, we can promote the mental stagnation and mental weakness, or the physical weakness of the body, with the promotion of the originating rhythm of the organ of the body, pancreas. These are the combining action and the pathological invasion of the urinary natrium.
Yes,
Okay.
sir. Yes, sir. Then there's a question from Dr. Margija. For cancer, acid force which potency?
Suddenly, sir, if we get as a total constitutional confirmation, because we are always confused with the differentiate the calcarea group, natron group, and acid group. Only it complementary relationship with the ammonia group. So the differential diagnosis, the constitution is a very much difficult. There lies the efficacy of treatment. Calcarea carba has got mental anxiety. So acid has not mental anxiety, but calcarea carb, these two constitutions, even in natrum constitution, natrum is thin, and psychotic in nature. In calcarea group, there is flatty, floppy, fear, and other exhausted like acid. In acid group, it is a syphilitic appearance. The white cultured person will gradually turn to dark, exhausted mentally and physically, with entire changes of general appearance. We have to differentiate each these constitutional difference with the miasm and thermal reaction and craving and the maintaining cause. Then we get the exact picture. If we get the exact picture of acid force, we can give 1 more 10. It will act for 60 days. We can complement it with uranium, natrium, cesium, or our geminima, or our Aproma angustra. All this, if the selection of acid force is correct, the diabetes will cure. The only things are we have, when we eat excessive carbohydrate, our chore and godam, definitely the remission of blood sugar is very, very much difficult. We can see that in advanced, in generally, the diabetes are treated by diabetic specialist. Even after 5 or 6 or 2 or 3 years treatment, the specialist will stand with 3 or 2 times insulin and 3 type of tablets, but unfortunately the fasting sugar is 220. But there is no problem with the patients. In homeopathy, if the only our medicine and advise with the strict diet, if the fasting sugar is 130 or 140 or 150, the patients will quarrel with us. They are making anxiety. Why it is like, why not reducing? So the general status in my 40 years of practice, I study that eating if we eat rice, it is very much difficult to reduce the sugar with our medicine. So I advise always millet. But for last 1.5 years, we have got generally good control of diabetic patients. Or certain 30% a cure for diabetes, and or 60% palliation for diabetes with the 2 times millet and 1 time sugar with our medicine. It's a very, very good result we get. So the general advice was that. In malignancy also, we have to find the maintaining cause and the general mental picture and the urination profuse. The main things, it is a deep syphilitic medicine, so the pathological discharges will aggravate after. It's a main clue for selecting acids. So
Sir,
these are our clues to come into simillimum of even in cancer or in diabetes or in diabetic gangrene or any ulceration. Okay.
sir, what is your experience with the diabetes above 10 HbA1c above 10 or 12? And
Sir, you have to put the patient. The one thing, when we call for the appointment for diabetes, we promise one thing. We will take over. When we restrict your diet with avoid sugar in maximum and take millet. If you are ready, we have to come over our dispensary. Like I use Prakriti's very good 8 type of millet in our dispensary with a registration of food. Authentically, we take registration of food only for sale the millet for our diabetic patients, even chronic liver diseases. If we reduce the in cirrhosis liver, in HCC, or any complicated metastasis in liver, if you take millet 3 times, definitely we can avoid the depacting modern medicines, diabetic medicine, especially insulin, the uremic conditions, and the HbA1c even within 3 months. If we take advice to take 3 times millet, the entire HP come down into 7 or 6.5 from 10 within 3 months. It is my experience. Nowadays, we are happy with our diabetic treatment.
yes, if anyone want to have a chat or anyone have a doubt about any of your patient or any of the subject discussed tonight, you can raise your hand so that we will allow you to unmute yourself and speak to Madhusudana Panickere sir. Yes. Anyway, this is a big subject, as you all know, that the acid group itself is a big one. And specifically, we are concentrating more on this acid nitricum as well as acid rosa. Sir, what is your experience with the acid nitricum group?
Basically, acid nitricum is a same affecting as mersol. The thing is that the mersol constitution is always abuse, dark darkish appearance, sweat aggravation, sweat aggravation in sun, and sweat stain darkishly in the body, especially on face, a large flabby tongue, imprint of teeth, exhaust after short back, night aggravation. These are findings in mersol. But in acid nitric, the characters of, later we discussed the characters of extreme prostration, it is not found in mersol except in cancer of the mouth. Then the other, even though the acid nitric is ability, it is not bilateral. Most probably it is unilateral. So other than mersol always is a bilateral medicine. By cancerous lesions, mostly with the bleeding tendency, is the nature of syphilis. Acid nitric is sharp, only in cutaneous, along mucocutaneous junction with the deep cutting pain or sharp pain. But mersol, the pain is aggravation, most probably in nights. It is relieved by discharge and blood-stained mucous membrane, mucous membrane discharge. But in acid nitric, the mucus structure of the mouth, even glands, cheek, the bleeding, the ulceration will happen, and the bleeding solely find that ulceration. But general ulcerations is very little in acid nitric. Specific, spot-like, localized, isolated ulcerations are more in acid nitric in comparatively lean thin constitution. So the general talk and discuss with the general characters. When in appearance itself, we can separate the symptoms and constitutions with the aggravation and ameliorations with appearance of ulcer, the nature of bleeding, and the bilateral appearance. All these things are entirely we can select this group of medicine very easily when we physically find the lesions.
Okay, sir. Thank you very much. And now I invite Dr. Mahadevi Ambadi to say what the thanks to the session as because time is about to finish. And tomorrow we will have a session from another doctor from Kerala, that is Dr. Harish. He is a his specialty is usually about rubric discussion and the case presentation. Anyway, let's just.
Dr.
Yes.
Dr. Bhadrama is here.
Yes, Bhadrama madam is there.
Oh. Good evening, Bhadra, doctor.
I'm not Magdrama, I am Dr. Madhya Badi Panickere.
I know Ambadi madam. Bhadrama madam is also
Is also here.
watching. So
Oh, I see.
let us go
Teacher is
to.
there. Teacher is attending the section every day.
Yes, let us
Teacher is attending.
before going to vote of thanks, we can invite Bhadrama madam to say a few things.
Very nice.
Yes, please unmute, madam.
What about Ambadi Devi?
Bhadrama madam, you can, but please unmute. Okay.